What is a cystic fibrosis carrier, and how common are they? Imagine a tiny gene that can influence your health in ways you might not even realize. That's what the CFTR gene does. A cystic fibrosis carrier is someone who has inherited one normal copy of this gene and one mutated copy. Because cystic fibrosis is an autosomal recessive condition, carriers usually don't have symptoms or health problems. They're healthy because the normal gene copy can usually do the job of regulating how chloride and bicarbonate ions move in and out of cells. This process affects mucus production in organs like the lungs and pancreas. When both copies of the gene are defective, thick mucus builds up, leading to the symptoms of cystic fibrosis. But carriers have only one mutated gene, so they typically don't experience these issues. Most importantly, carriers can pass the mutated gene to their children. If a child inherits two mutated copies, one from each parent, they will have cystic fibrosis. If they inherit only one, they become a carrier like their parent. The chance of this happening depends on the parent's carrier status. For example, if both parents are carriers, there is a 1 in 4 chance their child will have cystic fibrosis, a 1 in 2 chance the child will be a carrier, and a 1 in 4 chance the child will have no copies of the mutated gene at all. Carrier status is surprisingly common, especially in certain populations. In people of European descent, about 1 in 25 individuals is a carrier. That means many people walk around unaware they carry a gene for cystic fibrosis because they don't have symptoms. This is why carrier screening is often recommended, especially for those with a family history of cystic fibrosis or those planning a pregnancy. Knowing your carrier status can help with family planning and give you important information about your genetic health. Research is ongoing, and some studies suggest that carriers might have a slightly increased risk for certain conditions like sinus infections or pancreatitis. However, these risks are much lower and less serious than in people with cystic fibrosis. It's important to remember that being a carrier doesn't mean you will develop the disease or experience health problems related to cystic fibrosis. In summary, a cystic fibrosis carrier has one mutated CFTR gene but remains healthy. They are quite common, especially in certain groups, and understanding carrier status can be a valuable part of family planning and genetic counseling. If you're curious about your own status or that of your family, it's always best to consult with a healthcare professional or a genetic counselor who can provide personalized advice based on your family history and health.